Hello and welcome back to my channel. When facing breast surgery, the instincts can be to choose the most radical surgery. But is this always the best path? I will uncover the compelling evidence that shows you that having less invasive surgery can offer superior outcomes for both your physical as well as mental well-being. Just take them off, both of them, so I don't have to think about this again. If this is the first thought that's racing through your head after breast cancer diagnosis, you're not alone. I have a lot of patients who feel this way, whether or not they want to share that with me when they receive their breast cancer diagnosis. But what if all studies show that smaller operation, the one that leaves most of your breast tissue, actually keeps you alive longer? Stay here for 5 minutes and I will run you through the numbers, the myths, and day-to-day reality of why less can turn into more years, more energy, more you. For a very long time, radical mastectomy was the hero. This is the surgery where surgeons removed the breast tissue, the pectoralis muscle, sometimes the rib, as well as all the lymphatic glands. And it was done because they didn't have fancy new treatment like radiation, chemotherapy, or drugs. So it was thought that this would lead to the best survival. Here you can see the image of a woman who has had a radical mastectomy or Halsted procedure, which was the one on the right of the screen, and modified radical mastectomy, which is on the left side of the screen. You can see that there is no muscle, and it's quite a debilitating surgery. And the modified radical mastectomy was leaving the pectoralis muscle and leaving the ribs. You can see that it gives you a better look without any compromise in the outcomes. Excellent diagnosis through ultrasound, mammogram, and MRI, to radiation, to really good drugs that we have these days that are going to hunt these cancer that might have gone somewhere else and basically kill them. And these days with imaging, we can find cancers that are only 2-3 millimeters in size and remove just that small amount of breast tissue rather than remove the whole breast tissue. Does having less surgery means worse outcome or better outcome or the same outcome? And in medicine, what we want, if we want to remove less, we want to lead to better or the same outcomes without causing too much of side effects of our treatment. When we look at the latest data, the Swedish study has shown that the breast cancer specific mortality after having breast conserving surgery or lumpectomy and radiation had better outcomes than having mastectomy. Big American study that spanned over 30 years has shown exactly the same outcomes and was reported in 2023. In 2024, meta-analysis, which is basically a way for doctors to put together a lot of different studies from all over the world, have found exactly the same, that having breast conserving surgery led to better overall and breast cancer specific survival. So having less meant that you lived longer. What these studies have shown that approximately around 20 to 25% of women lived longer if they had breast conserving surgery. You had the same outcome, whether you're young, older, whether you had ER/PR positive cancer, triple negative cancer, or HER2 positive cancer. The studies show that despite us feeling that we should do more to get rid of the cancer, actually doing less, if possible, gives us even better results. So less is more. But you might ask, do these women have better quality of life if they have less surgery versus more surgery? And imagine if you wake up after having a surgery and you look under those furry hospital gowns and you look at the breast that look familiar, that look same to you. This is what we're trying to achieve. There's no hollow chest, there's no flat chest, there's no tissue expanders, there is no long surgeries that your body had to go through. And some of the surgeries for reconstruction go 5 up to 10 hours. Women who chose lumpectomy, breast conserving surgery, have higher body image scores, lower depression rate, lower lymphedema risk, and faster return to work or their daily activities or being able to do what they want to do. And multiple studies and meta-analyses have shown this, that women treated with lumpectomy or breast conserving surgery and radiation report better body image, higher breast satisfaction, and greater psychological well-being compared to those who have had mastectomy with or without reconstruction. Yes, radiation may mean that you might have to have a treatment for up to 4 weeks, but today's radiation is really good. Machines are really excellent, and the side effects are much less than what they used to be. To be honest, treatments take 5 to 10 minutes. It's actually often harder to find a hospital car park than it is to have the treatment. When it comes to recurrence, all the meta-analyses, which are those complicated studies, show no difference in the recurrence rates between lumpectomy and radiation versus mastectomy. Lumpectomy and radiation has 10-year recurrence rates of 2 to 5% or up to 8.5% over 15 years versus mastectomy of around 2 to 3% over 10 plus years. If the tumor does come back, it is disappointing. It is, again, scary. And not a lot of women will actually get this recurrent. If you look at 100 women, only maybe 8 will get the recurrence. And we're talking about the recurrence in the chest wall or armpit. When it comes to metastatic recurrence, or recurrence of cancer coming back somewhere else, there is absolutely no difference between breast conserving surgery and having mastectomy. So if we have a local recurrence, we can remove the breast and we can treat it. Who qualifies for breast surgery? It is primarily because the surgeon thinks that they can remove all of the cancer with the margin around. If you have a big cancer, you can still sometimes remove it with breast conserving surgery, but you have to have a bigger breast. And it also depends on a position where that cancer is. So here, in this middle part of the breast, whether it's a right or left side, you can remove always less than you can in the upper outer or middle part of breast. And that's because here it's a cleavage, it's less breast tissue, and it's harder to hide a big excision without leaving the signs of scarring. While here it's much, much easier. For women who have BRCA mutation or really high risk of developing another cancer because of their genetic mutation, we do sometimes recommend mastectomy as well. That mastectomy reduces recurrence of the next tumor, but it doesn't change the outcomes of the tumor the woman already has. And the last thing is that you have to be willing to have radiation, because we know that if you don't have radiation after breast conserving surgery, your recurrence rates are higher. So if you have these factors, then you are eligible to have breast conserving surgery. That doesn't mean you should have it. It's still your choice, but you are eligible to have it. If you choose to have a mastectomy, that's fine too. If some women have a large tumor that is quicker growing, so it's either ER/PR negative or triple negative or HER2 positive tumor, or it's a higher grade ER/PR positive HER2 negative tumor, Sometimes we can use chemotherapy before to shrink the tumor, and those women can then, after that, have a breast-conserving surgery as well. There are a few absolute no-nos where we will not perform breast-conserving surgery. And that is if you have certain autoimmune condition that preclude you to have radiation, like scleroderma. If you've had prior radiation to that same breast, or if you're pregnant in the first trimester. These are the absolute contraindication, which means we will not give you the radiation, which means if you have a breast conserving surgery, you have higher risk of cancer coming back in that breast. When you talk to your surgeon or your medical specialist, or if you're there with a family member who's going through this, arm yourself with the knowledge and ask, can I have a lumpectomy, a breast conserving surgery plus radiation versus mastectomy? Can you remove this without deforming my breast? How likely it is that am I going to have radiation even if I have mastectomy? Because we do use radiation for women who have had mastectomy, who have lymph nodes positive after removal. And most of our surgeons like or enjoy talking to people who have already armed themselves with the knowledge of what will happen, what can we do, and then we can have this discussion of what you would like to have done, and we make a plan that's specific for you. If you feel that your surgeon is rushed, that they are not listening to you, you can always ask for a second opinion. There's nothing wrong with that. Reconstruction is not everything. Instagram is full of flawless reconstruction, but there is actually a lot of chance that something might go wrong with reconstruction. What photos don't show is going through 6, 8, or longer hour operation, having weekly expanders being filled. 1 in 3 chance or more that you're going to have more than one operation. And a lot of women will have chest wall that doesn't have sensation. But at the same time, reconstruction can be perfect for some people. And this is where individualized care is the most important thing after being presented with all of your options. If you have a other half, your partner or a family member who's saying, take the boat so we don't have to worry, or my friend did this and now they have died. Remember, the fear is real, but the data shows us something completely different. Bring people like that to your appointments with your specialist, because most of the time, whether it's your parents, whether it's your partner or your friends, they want the best for you. They just want you to be well. And they don't want you to be going through this breast cancer journey, no matter what it is. And they're afraid for you. So bring them along so they can also ask questions. They can be told the right information so they get those fears dispelled as well. And they understand what actually studies are telling us and what is the real information from hundreds and thousands of women we see, and what is sometimes fear. So with a breast conserving surgery, most of the time you will have the surgery and go home on the same day, or some surgeons will keep you in overnight. Most women are back to light activity within a week, and between 4 to 6 weeks, they're back to full activity without any issues. When it comes to reconstruction, most women are off work for 6 weeks, and it takes them 3 months and longer to get back to full activity. But for some women, breast conserving surgery is not an option. And this is when they have a big cancer that it's not possible to preserve the breast. If you have a BRCA gene mutation that's associated with high risk of developing a breast cancer, if you've had prior radiation, or maybe you've just chosen to have a mastectomy. The goal of breast surgeon is to inform women that breast conserving surgery is a good option, and in some ways is a better option than a mastectomy for majority of women, and also to give you knowledge so you can decide what is the right thing for you to have. Myth number 1 when it comes to breast conserving surgery: you can't get clear cancer edges without performing mastectomy. That's untrue, because all the tissue that we as surgeons get sent after the surgery to be looked under the microscope. Every cancer that's removed is put through pathology, and parts of the millimeters are looked at to ensure that we have clear margins. And if margins are not clear, sometimes we do second or third operation to remove more. Myth number 2, radiation is worse than mastectomy. That's completely not true. Radiation these days is very targeted. You have a CT scan that looks at your chest wall, the computers that plan how to give you the radiation to minimize any effects on your heart and lung and minimize the effects on the skin. And serious side effects are less than 1%. Myth number 3, flat means safe. That's not true. When it comes to metastatic disease, doesn't matter what surgery you have, whether you have the breast conserving surgery or mastectomy, the risk of cancer coming back with the clean margins is exactly the same. We just talked about the survival rates, that if you have lumpectomy, your actually survival is better than you have mastectomy, as long as all the tumor has been removed. Myth number 4, if I don't have mastectomy now, then I'll have operation down the track. That's not the case. As said before, your risk of developing breast recurrence after radiation and breast conserving surgery within 10 years is 2 to 5%, and more than 10 years is up to 8%. So majority, 92% of women, will never get recurrence. Usually around 3 weeks or so after having breast cancer surgery, and no matter what the surgery is, you often emotionally hit a slump. And that's for a couple of reasons. One is that we're so emotionally invested in surgery, and we're so often terrified of surgery. So we'd say, well, once I've had my surgery and know the results and the cancer is gone, it's all well. And the second reason is that we get huge endorphins release after surgery. So we are quite high when it comes to the emotional reaction to that. And then after 3 weeks, we realize, actually now the rest of my life is in front of me. And the survivorship marathon becomes where we fear of cancer coming back. Talk to your support people, have therapy, exercise, because all of this will speed up your recovery. And not just physical recovery, but also psychological recovery. And all this helps with having PTSD type symptoms from having been diagnosed with the breast cancer. We also know that women who felt actively involved in their surgical decision-making have lower PTSD scores. So knowledge isn't just power. It also protects you and guides you towards longer and happier life. We know that the future is going to lead towards less surgery, because that's what happened even in the last 10 years or 15 years since I've been training and working as a breast surgeon. We now have a shorter radiation option as well. There are trials to show us whether some low-risk cancer can skip radiation after lumpectomy plus having hormone treatment. There are studies about cryoablation where we can freeze the small tumors through a needle. So far, the early testing, it shows promising results, but this may be suitable only for a small number of women. Also, women who have positive lymph nodes and they have chemotherapy first. Sometimes now we're doing less of the lymph node removal as well. The trajectory through history is that we're doing less, which gives women better quality of life. If this is the first time you've heard that lumpectomy plus radiation leads to longer life, hit subscribe for more evidence-based, hype-free videos that are on the way. Know someone who's scrambling for the answers, especially at 2 o'clock in the morning? Please share this video with them. And remember, take it all is a fear talking to you. Now you are empowered with the knowledge that having lumpectomy leads to longer life for most women with early stage breast cancer. Doing less isn't settling, it's science. It might be the most life-affirming decision that you ever make. Thank you for watching this video, and bye for now.